I was contacted by a first-year medical student about a week ago saying that there was challenges for them to attend and also go to their classes. So I reached out to the College of Nursing, and they stepped forward and sponsored us and supported us in recording all of today's speakers. So just a hand for the College of Nursing, please. Okay, first up, Dr. Barbara Fornssler.
I'm really grateful to have the opportunity to speak to all of you, and I'll take a moment to introduce myself. I'm a cisgendered white settler who's living on Treaty 6 territory in the homeland of the Métis. I also am Dr. Barbara Fornssler. I work in the School of Public Health as a faculty member there, and I also work for the Canadian Research Initiative in Substance Misuse, or CRISM as we're known. You're not in health research if you don't have a bunch of acronyms, right? So that's the most important part. I do have some notes today. Dan was like, I'm going to hand you a microphone for half an hour and just let you go. And I was like, that's a dangerous thing. You know, I've been trained to speak, right? So only half an hour, right? So I typically in classes would be talking for like 3 hours straight and hopefully engaging dialogue. But what Dan really asked me to talk about today was stigma in healthcare. And that's stigma around substance use and the use of substances, and really what the role of stigma is and how we might go about addressing it. So I know that many of you are very familiar with this topic already. So I keep my notes out just to make sure I'm on track and not derailing, because that's how I was trained. But I do want to thank and acknowledge each person here today for taking the time to be here, and for acknowledging members in our community who so often go unseen. And we want to raise those voices up. We want to raise this awareness, and that's a big part of what this day is all about. So, stigma in healthcare. Yes, this is a serious issue. And if anyone had a chance before this fine pandemic hit us in 2019, the Chief Public Health Officer of Canada's yearly report was all about stigma. So you can look that up, Dr. Teresa Tam. And really what it was talking about was how stigma impacts healthcare and impacts access to healthcare more than anything else. But what is stigma, right? We want to have a bit of a definition because that's how us researchers like to work. But stigma is discriminatory attitudes, beliefs, and behaviors. It's the judgment that so many are met with when they're not an ideal patient, or the judgment that prevents a person from ever becoming a patient or ever seeking that healthcare that they might need support with. There's 3 kinds of stigma that we talk about in the research world and when I'm teaching about substance use. And that is structural stigma, social stigma, and self-stigma. It often concerns me that we have so much stigma going on that we have to classify it and group it into different categories. But that's unfortunately where we are today. So when I say structural stigma, right, what am I talking about? Well, we're talking about not having an appropriate continuum of care. What a continuum of care is all those services that someone might be able to access at any point in wanting to seek more information about their relationship with a substance of use, right? So that's everything from harm prevention, harm reduction, all across that continuum, right? But prevention and of course treatment services or support services for healing, and then recovery services as well, right? Aftercare and continuing that follow-up in those relationships. And when we don't have that full continuum, when all of our funding is going into just that acute care, that hospitalization, that becomes problematic because it's seen as the only solution. And it's not the only solution. What we know from the research evidence, peer-led support services are some of the most effective supports that we can provide to people. Why? Because people who also have used drugs or currently use drugs, are some of the best facilitators of that healing process. They've been there, they know it personally, but more than that, the person seeking that support, they're not worried about being judged. They're not worried about being told that they're bad for their behavior and all of those other moralizing tendencies that we too often see in healthcare and service provision. Then, of course, we're dealing with social stigma as well, right? We've had a war on drugs for over 80 years, and that messaging has unfortunately been much more effective than a lot of our health-focused messaging. They had bigger budgets, right? They had bigger platforms, unfortunately. So that war on drugs pushed our whole society into thinking about substance use as a criminal issue. This is not a criminal issue. This is a health issue. And that's why someone like me in the School of Public Health is standing up here today saying, this is a health issue. It belongs in the realm of health, not justice. And that when we can start thinking about people as hurting rather than bad, we can start to address their needs and support them in their healing journey. But until we make that change, right? Until we're able to see this as a health concern, as something that may impact our health status, and that is the outcome of social determinants of health, as we call it. But these larger structures in our society, we're not going to be able to make those changes. So we need to help and assist our friends in thinking, and our family and our colleagues and others in thinking about, hey, the use of substances can be a response to harm, to trauma, to issues and feelings that we're not able to resolve sometimes independently. And it's okay to reach out for help and to seek that support, most importantly. So that's the social stigma that we need to address. And then, of course, and many of us know this personally, that self-stigma. It's how we internalize those social and structural values that are around us every day, right? And it's that shame that we feel, that fear of judgment when we want to seek support or services ourselves. And that can be very scary because it's very isolating. But it doesn't have to be that way, as we know. Stigma is part of the reason that people are often surprised when I disclose my own use of substances many years ago now. But when I talk about being a party kid in Vancouver's rave scene in the late 90s, early 2000s, yes, I used crystal methamphetamine. Yes, I used ecstasy. They call it Molly now, so that just makes me feel old. But the point is, many people, over 20% of Canadians at some point in their life, will meet the diagnostic criteria for substance use disorder. That is huge. That is a huge percentage of our population. And we need to make sure that wherever folks are on their journey, that they're supported, cared for, and they know that they belong in this community, and that we care, and that we're here to support. So it's particularly important, as I often say, to stop the stigma in healthcare, despite the fact that it can be overwhelming. The good news, we made all of this happen, right? People before us, they made all of this happen, all of this stigma, all of this judgment, all of these things that are going on as barriers now. But that also means that we can unmake it. We can remake this situation so that the stigma doesn't continue, so that there are appropriate resources and supports. We need to continue to have that hope, and not only that, but that advocacy and that effort to push for change with our policymakers, with our decision makers, and with our entire health system, wherever possible. So most of you know this. I feel like I'm preaching to the converted largely in this room when I talk about the influence of stigma. You all know that it's out there. As was said to me this morning, it's rough out there right now. The harms are magnifying, and we don't have appropriate services and supports in place. And we need everyone in this room and many, many people beyond this room to amplify this message and advocate for those changes. So, Dan's like, let's talk about some material things that we can do. And I think sometimes, especially today, when everyone is very, very tired, very burned out from the work over the last number of years, and even before then, right, we're exhausted. So we need to come together. That's the most important time to come together as a community. So attending this event is where we can start, where we have started, right? So when you leave here today, tell someone that you attended International Overdose Awareness Day. It offers an opportunity for them to say, hey, maybe this person isn't going to judge me if I open a conversation. If I start to discuss, what does my substance use look like, and what do I want my relationship to substances to be? We can't have that conversation under a war on drugs mantra, and we can't have that conversation if we're too afraid to speak. So we need to speak it, and we need to offer those opportunities in a non-judgmental way by starting that conversation. And it can be as simple as saying, yeah, I was at International Overdose Awareness Day today, and I learned a lot. And I took away a message of healing and hope. And I know that we can make this change. And that's going to offer a safety to the people that you're speaking with to have that conversation, to ask those difficult questions so that we can begin on this journey. You've often heard, probably most folks in this room have heard about how person-first language can lead the way, right? So we're not going to label people, in terrible ways that we do. Instead, nobody's a label, right? We're all complex human beings with multifaceted identities. We have many diverse experiences in life, and using substances might be one of those experiences, but it's not our totality. So, really important, we're not going to label people addicts anymore, right? We're going to say you're a person who uses substances, right? That person-first language can help lead the way. And when I use terms like that, person who uses substances, people go, that's not terms I've heard before. And it starts them thinking on their own journey about how they are understanding people who use substances, how they're understanding this situation, this war on drugs, the policy failures, and overall what substance dependence might mean and how we might address it. So we're trying to shift big world views. We recently did a research project here in Saskatchewan. Can't get on a stage as a researcher and not share some outcomes, right? But I think it really underscores the need to address stigma and reduce it. So we spoke with people who use substances, asking for their perspective on how to make change in policy and in service delivery. And the big finding out of this study, which I'm sure will not be news to anyone in this room, was that a sense of belonging is what facilitates access to services. Not shocking. But now it's in research evidence, so you can cite it and you can argue with it. And that's part of the advocacy that we do. Thank you, Dan. So belonging is a powerful force for change. Belonging is connection, right? What's happening when we feel we belong? We're connecting. We're connecting with people, with friends, with family, with our broader community. Belonging is connection. It's a sense of safety, that I'm not going to be judged, that I'm not going to be told I'm bad, that I'm going to be heard for my truth, that my words are going to be respected and supported, and that I'm going to be able to share my struggle with others. And in that shared struggle, that we're going to lift each other up and support each other so that we can all move forward together as a community and as a collective. At the end of the day, belonging and that sense of belonging is community. It's what we feel today. It's why we're here today, right? It's that sense of belonging, that we're not so different from everyone else, that and that we are different in a positive way, though, right? That we share this struggle. And so when we can come together as a community and talk, by joining together as a community to mourn and grieve, to share that grief together, to acknowledge all of the people that we love, and to care for one another, we're starting to make that change. This didn't happen. When I started in this field in 2011, this was a very small event. There were very few people, and there was much less knowledge. But little by little, it's been building momentum. On the backs of too many lives, no doubt. It shouldn't take a crisis to make change. Unfortunately, that's where we are. We are in a crisis of substance use harms, of mental health support failures, of our system being under great strain. Each of us is under great strain. And one of the ways we can alleviate that strain is this. We come together. We see that there are hundreds of other people, not just here today, not just in Saskatoon, but in Regina too, and all across the country and around the world. People are gathering to say this matters. You matter, that we matter, and that we're going to make this change together, and that we can. I was going to try and have some kind of like amazing send-off, because you always want to do that when you're opening an event, right? But at the end of the day, I think that we are ending stigma around substance use right now in having these dialogues, in knowing what service organizations exist in our communities, in knowing the people who are populating our communities every day. I'm grateful, so grateful to be here with each of you today. It is truly an honor and a privilege. And to speak by invitation, thank you so much, Dan. It's a great privilege and an honor. I know that our grief brings us here, and I believe our hope will lead us forward. So to each of you, thank you. Dan, I think I kept within my time limit, and I'm really grateful. I'm looking forward to more information exchange and a great conversation over today. Your one task, share that you were here with someone who wasn't here today, and we'll reduce that stigma. Thank you all.
If there's any questions or comments, you'd like to add something to that, or if you haven't, like a question.
If anybody wants this microphone.
So Kathy Pruden and Cell, Western Region 2A, Métis Nation, Saskatchewan Regional Representative. And I'm having a hard time saying this sentence now because you said don't use the word addict. I'm also a recovering addict.
It gets, and
substance abuse user, a recovering substance abuse user.
Right.
Been in rooms too many years.
It's often my opinion. However we speak to our own experiences, that's our business, and whatever words we use that best express that, that's our business. I'm for that. When I train people academically to write research reports, that's when I get picky about language. Okay. So,
all right. But it's a good practice to actually be saying those.
Right.
So my question is, we're talking about stigma. Yeah. And one of the stigmas that I've had a few discussions about is the stigma of treatment. Yeah. Because those of us who are connected to substance abuse in any form or way, whether it's professional, family, friends, community concern, or personal. 30 days is not enough.
No.
And I think there's a stigma. Myself, I have been in treatment a number of times. And every time you don't succeed, it's a further stigma that you're a failure.
Mm-hmm.
When you come out, you relapse. So I think we also have to have a little bit of focus on this whole 30 days, the key treatment number, because we're setting people up for failure, and we're not doing the continuum of care, for one thing. I mean, we can go all over the place on that one, but
Absolutely.
I'm really concerned about the message that we're instilling in people that you should be fixed in 30 days,
Yeah.
because it's a lie.
100% it is. 100%. That model, thank you. Super important topic, and absolutely. And I think that sense of failure, that is absolutely that stigma going on. When we talk about chronic relapsing conditions in any other field of health, that's not shamed. That's understood as part of a healing journey, right? And it's absolutely too short a time. What my understanding of the 30-day treatment program model is that that's what insurance companies would pay for. That's not a health-led model of care, right? That's a business-led model of care. So no, we can't allow for insurance companies, particularly in Canada, where we want to ensure public health services are available for everyone to access. We don't need to follow that same model that isn't evidence-based and is in fact rooted in what the money makers are saying, right? So when we learn about that, then okay, maybe we can only provide right now an inpatient, intensive care of 28 to 30 days because that's what's available in our system. What can we do on either end of that as providers, as people who care about people who use substances in our community? Peer support groups, again, one of the most important aspects of recovery and care and that healing journey. A group of people who accept you and who support you in making the changes in your life that you deem most important. That autonomy is another key issue, and I raise it particularly because notions of involuntary, let's call it what it is, it's forced treatment, it's coercive treatment, those ideas have been showing up in our news reports, right? So autonomy of the person is one of the most important things, and we know that from research literature. When you take away people's autonomy, they feel disempowered. What are we going to do to cope with that? Probably use substances, right? Because we're feeling like we don't have power anyway, so what's the point? And so that kind of defeatism that can come out of that system, I think we can overcome through peer support methods right now, and of course, hard advocacy for more enhanced treatment funding so that that continuum of care is a continuum and not a one and done kind of approach, because nowhere else in healthcare works like that. Nowhere else says one and done should solve it. If you're diagnosed with, cancer or something like that, there are 5 years of follow-up and extra supports and peer groups and all these others. Like, there's a lot going on. There's a robust continuum of care that screens, that prioritizes, that helps you navigate that system of care. And we don't see the same for substance use services, at least not in this province. And we need to see that change, right? So we need not only acute care beds. Those are important, yes, absolutely. Also, where are the 120 extra beds we were promised 3 years ago? Just going to raise that again. So that's important, but it's not the full picture. And so when we can start to see a fuller picture of what recovery, what our relationship to substances is, when that relationship might become harmful, how we can address those harms, and then have a recovery as well. When that's all supported, we're going to see a lot more success. In other words, people will be able to achieve the relationship with substances that they would like to have, okay? So that's the other thing. Treatment doesn't always have to mean abstinence. It can. But one of the things I appreciate most about Hard Knocks Talks is that they're encouraging us all to find a safer way to live, whatever that means for you and your relationship with substances. So we can have that autonomy, we can think about our own relationship, and then we can take steps to make the changes that we would like to see. At least there's hope. It can exist. And if we can think it, we can do it. That's at the end of the day, what it comes down to. If we have no hope, if we say there's no solution here, then there won't be. But I know there's solutions here. I read about it all the time in research. I read about effective methods. I see it in the community. I see support workers everywhere, frontline workers providing these services, looking after people. Mr. Rogers, I like to quote Mr. Rogers. Mr. Rogers' Neighborhood, I'm sure some of you might know. But he talked about when, when he saw scary things on TV, his mom would say, yeah, but look for the helpers. There's always the helpers, right? So one act of violence and you see 50 more people running in to help and assist. And that's what I see in this room today, is the helpers, the people who are leading the change. Yes, bad things happen, harms happen, but 30 people are running in to help and to respond and to support those in need. And it's that we can draw strength from, knowing that we are not alone in wanting to be those helpers, those people who assist and help and support solving this problem in our community. All right, I went a little long. Thank you, Kathy.
Is there anyone else? Comments, questions? Someone in the back? Hang on. Oh, I knew I was going to end up running around today.
Getting your workout in. It's leg day, Dan.
Hello, Betty.
Hi. I'm Betty Nippy Albright, MLA for Saskatoon Centre, and also the critic for First Nation Métis Relations. This is a really huge, difficult problem all over the world. One of the issues that I guess the question I have is often, like I'm a First Nation woman, and I'm attending so many funerals of drug overdose in First Nation communities. And I see many First Nation communities that do not have the capacity to address the root causes. And I also worked in healthcare for quite some time. And the challenge has always been, how do you work intersectorially, within jurisdictions? How do you do that? And how, I guess my question to you is, because this is a crisis, this is something that needs to be addressed, and our First Nation communities are impacted by drug overdoses, like the social issues that they encounter. How are you, I guess in the health sector, in the encouraging that more intersectorial work, interdisciplinary work within the First Nation communities, so that First Nations or the communities don't have to go to large urban centers to try and access the services?
100%. Thank you so much. Beautiful, wonderful question, and really important topic. So there's a wonderful document, decolonization is harm reduction, and that's a resource that I suggest everyone access as soon as they can. But also, there are many organizations like Thunderbird Partnership Foundation. So partnership is going to be a huge part of this. Not like collaboration that's like half an hour in a room kind of thing, but I mean genuine partnership in addressing these harms, taking account of the resources that may be available in a home community, and also looking at how we can reallocate. So, but partnership is going to lead the way. So there's also the NADAP and YSAP systems, right, at the federal level, and those are wonderful centers and resources for talking about different approaches to healing and recovery, such as land-based recovery camps and things like that. There are different and innovative modes happening with the NADAP and YSAP centers that are not just culturally based, but culturally founded, and they come out of the principles. So I encourage everyone to look at Thunderbird Partnership Foundation. They're a leading advocacy organization in Canada that is addressing substance use harms from an Indigenous perspective, primarily First Nations, but also working to build resources for Métis and other communities. So what their role is at Thunderbird, just to give a little bit more background, they support NADAP and YSAP programming within the treatment centers there, but they're also adapting a wellness assessment to be used in community settings so that priorities can be identified collectively and that solutions can be figured out amongst community leaders based on the resources that are available in that community. So if, I'm gonna steal Johan Hari's statement that basically the opposite of addiction is not sobriety, the opposite is connection. Colonization has severed connection across generations within communities, and we're in a terrible situation. I don't talk about colonization as something in the past. It is here, it is with us now, and it is a huge driver of harms regarding substance use and mental health, right? And that disproportionate impact that we see in First Nation communities. And I do think there are community-based solutions for these harms. And I think that Thunderbird Partnership Foundation holds a lot of that knowledge and can put you in touch with those knowledge keepers who can help facilitate that conversation and support people who our colonial systems of care have left out and deliberately excluded in many cases. I don't know that that fully addresses your question, but I thank you very much for asking it. And I do, again, think in partnership, we can build the relationships for healing that are needed in all our communities.
Okay, we have a couple minutes left. Oh, I was going to ask a question, but I guess I'll.
It's good. Keep me out of Dan's hot seat. That's the goal. So,
my question to do with stigma is in the emergency rooms. So my son went with me. He went and admitted himself wanting to get into psychiatric care. My son is a repeat visitor to emergency. I know that it's already on his form. So by the time the doctor came to us about 10 hours later, had already decided he's trouble. They showed up with 3 security guards. I think one could have done, but so would a Form 8 would have made a difference? I was told if I show up with a Form 8, and for those of you who don't know what that is, I guess I have to go to the judge, write down all the reasons why I think my son needs psychiatric help, and then he gets a copy too. But then would it really have made a difference because he was that close that he could have maybe gone into, I live south of Edmonton, but into our mental health facility because to help with it's been a 7-year psychosis. It's not just drug induced, it's ongoing. But it was the closest he's come to really wanting help. He even had gone through a 10-day detox and ready to go into a program. So would the Form 8 made a difference in the emergency room? Thank you.
it's a very good question. Not with the judgment and stigma that comes with a lot of our mechanisms in our formal health system. At the end of the day, I wish we didn't have a lot of these. That there wasn't a need, that we had the opportunity to offer care to people without regimented policies and steps and so on, that the care was just there. And I know these policies are supposed to create equity. And I think we need to look at whether they're doing that or not. A lot of times when I'm chatting with people, they say, oh yeah, but we have a system for that. We have a process for that. And I often ask, is the process working? Is it doing what you intended it to do? Has anyone evaluated it? Has anyone checked if it is working or having the outcomes that we're hoping for? The answer a lot of the time is no, when it's even been asked as a question. So it's, how do I put it? Because I never want to make judgments of healthcare provision decisions that were made, in a sense, I wasn't there, all these things, but do I think armed security guards are the best response to a mental health crisis? No, absolutely not. Ensuring that there is appropriate care and that people aren't prejudged on their way in the door, that makes a huge difference. Stacey Swampy said to me, rather than seeing people as good or bad, we need to see them as healthy or hurting. And that has stuck with me my whole life. When we work in emergency services, when people are providing healthcare services, you are addressing people who are hurting, not people who are bad. And I think if we could start our policy conversations from that place, we could develop better mechanisms together and in partnership to address exactly these kinds of harms. So yes, we need more mental health services available and ready when people are ready. And hopefully at an earlier point where someone is not in such a crisis that they are at the emergency room, right? Where they can say, right when they start not feeling well, I need some support, or I'd like to talk to someone. And it's not this, well, you have to wait 8 weeks unless you're immediately suicidal tomorrow. No, that is wrong. That's not support, that's reaction. So support means being there with the door open at any time that someone needs it, and not only in the crisis situation, because quite often by the time we're in crisis, there were so many opportunities prior, right? And that is, now, do we need better crisis response too? Yes. At the end of the day, we need better response across our entire system. And how do we do that? Yes, part of it's funding, but a big part of it is also education for healthcare providers. Mental health and substance use have not been a focus of training for our care providers for many, many years. There are specialized areas and specialized optional courses that you can take. And now it is finally being built into some of our systems of care and systems of training for those care providers, in recognizing that this isn't an individual moral failing, which was our prior framework, but in recognizing that substance use impacts, as I say, 20%, minimally 20% of Canadians will meet that diagnostic criteria in their life. And for some reason, this was absent in our medical schools and in our nursing colleges, and it was just not part of the curriculum. It is now part of the curriculum. It is moving forward. The College of Medicine is introducing additional training and more opportunities in nursing as well. And also in the School of Public Health, we are trying to bring focus to substance use harms and health concerns and how we might live better in our relationship with substances. So is it behind and is it reactionary? Yes. Does it need to catch up? Absolutely. But I am hopeful that with more training, more education and understanding, more empathy and humanity in our systems, putting that care back in the healthcare system, that these kinds of approaches will be a thing of the past that we talk about as part of our dark history in the substance use and mental health world. And instead, we're seeing healthier communities, happier communities together, and care providers who recognize, oh, this person is having a crisis right now. We don't need security, we need safety. We need to make sure this person is feeling safe in themselves, and that's going to go a long way to alleviate the symptoms that they're experiencing. So I am always sorry to hear those stories because it's not the right thing and it's not what should have happened. And when I hear about that, I'm like, no, our system is broken and we need to fix this and find common solutions. And thank you for that question.
Thanks so much. We have one more comment here, and then we're going to shut it down and do some networking.
Hi, my name is Patricia Whitebear with the Family Addictions Healing Circle. We meet weekly at the Friendship Center to help families and the ones in recovery to combine together, to learn from each other, to rebuild their relationships. And what we're learning right now, and it's really, really scary, is that youth are starting to drop.
No.
So my one quick comment, we need some education in the school. My granddaughter had a 14-year-old friend drop right in front of her, so it's happening, and they're targeting the young right now. So it's getting younger and younger and younger. I hear of 12 years old that are trying crystal meth and beyond. So just a quick comment. Thank you so much.
Thank you.
Where do you meet? What time?
We meet at 6 o'clock every Thursday at the Saskatoon Indian Métis Friendship Center.
Wonderful. And that is exactly why we're here today, so that we can tell other people that these supports are available and make sure that they know to access them, right? So thank you for your time. Thank you for your questions and for your generosity in listening to me on a stage this morning. I look forward to continuing this conversation over the day and to hearing from the other amazing speakers who are here to share their knowledge and wisdom with us today. Thank you all so much.
Ready? All right. Okay. New Executive Director of the Elizabeth Fry Society of Saskatchewan, Nicole Obrigavitch. The floor is yours, my friend.
Hello, everybody. I'm just going to send a proviso. I'm a little nervous, and I tend to black out when I'm nervous. I'm Nicole Obrigavitch. I'm the new Executive Director for the Elizabeth Fry Society of Saskatchewan. I'm also a cisgender female, and I'm a settler, and I'm quite honored to be living and working on Treaty 6 territory and the traditional homelands of the Métis. Today, I was supposed to be talking about housing, but I think I'm going to talk about a few other things. First of all, I'm going to talk about how I ended up in the position that I'm in and the insight that I'm bringing to community, because I actually haven't been in Saskatoon since 2015, and I only recently came back in the spring in February. I originally am from Saskatchewan and went to university here, and I got 2 degrees, 1 degree in sociology and a degree in law. And I ended up moving to British Columbia to practice law. And on the surface, everything in my life looked really great, but under the surface, it was not. I was in an abusive marriage, and I was using substances to cope. And basically, my life became very unmanageable, as it does when you're using substances. And I ended up losing my career and my children and everything important to me. And I found myself in raging active addiction. I attempted suicide. I tried to go to detox. I tried to go to treatment. I tried to get my children back, and none of that worked. Part of the problem was at that time, there wasn't enough treatment beds in British Columbia. So when I went to detox, what happened was a treatment bed wasn't available for almost 9 months after. And as a result of that, I started using again. And that just continued for years. And so I wanted to come back to Saskatchewan because I thought maybe that I could clean up here. But my addiction followed me, as it does. And when I came back to community, I ended up selling drugs for survival and then for profit. As a result of that, I ended up getting arrested for trafficking and ended up getting a 3-year sentence for trafficking. When I was released to Kamloops, British Columbia. I was on parole for a little bit under 2 years, and when I was on parole, I was still carrying a lot of shame about what had happened. The stigma in society for me around addiction was huge, and I didn't feel like I could be transparent about what had happened. When people took a look at my resume and they saw that I was a lawyer and I was applying for a minimum wage job, they knew something was off, but I wasn't prepared at that point in my life to be transparent about what had happened. And so I just basically covered up the fact that I had been incarcerated, that I was in recovery from addiction. And that stigma followed me. And I managed to stay in recovery for 33 months. And as soon as I got off parole, I relapsed. Went back out for, I think, about 4 months, and during that time period, it sort of occurred to me that I had some experience that a lot of people don't have. So I have 2 university degrees, one being sociology, one being law, and now I have this lived experience of recovery and incarceration, and that's an education that you can't buy. It's something that you can't learn from a book. And so I decided that it would serve me and it would serve people like me a lot better if I could be honest about who I was, where I've been, and what I've been through. And I think that it took only about 6 months, and I ended up getting a job with a harm reduction organization in Kamloops. They provide supportive housing, low barrier supportive housing, harm reduction housing for people that are in active addiction or have mental health issues. I just want to talk a little bit about the differences between BC and Saskatchewan, because I honestly feel like I'm supposed to be in Saskatchewan. When this job came up as executive director at Elizabeth Fry, I was like, this is a perfect fit for me because it makes so much sense. Full circle, I get to come back to community and make amends for some of the things that I was doing when I was in active addiction. And I can also bring some of the experience that I got in British Columbia to Saskatchewan as well. And I think that that was really important because there's a huge difference between what's happening in British Columbia right now and what's happening in Saskatchewan. And that became apparent to me as soon as I got into community. British Columbia has a housing continuum model that they are running off of. They've got a partnership with BC Housing, which is the provincial government, and they are building housing hand over fist right now, which is amazing to me. So I got a job with that harm reduction organization that provided housing for people that were coming right off the street, very low barrier, housing first model. You meet people where they're at. You don't try to treat them for addiction first. You don't try to treat them for mental health issues first before they're allowed to come into the housing. You let them come in with those issues. And once they're stable, then you're able to provide those programs and those supports so that they can be successful in their living situation. That program that I worked for was much like Prairie Harm. And I really appreciated working there as a tenant support worker, but I knew that, I wanted to do more for women. And so I ended up working for the Elizabeth Fry Society in Kamloops, and I started working with the supportive housing program there, and they have a supportive housing program that supports women that have substance use issues, mental health issues, and have custody of their children. And so it's about providing those supports so that people can keep custody of their children while dealing with those underlying issues. Kamloops, Elizabeth Fry is really fortunate in that they have the supportive housing program, but then they also have affordable housing as well. And so once you graduate from the supportive housing, you can move into permanent affordable housing. So there's a housing continuum there. You can go from detox to treatment to supportive housing to affordable housing, permanent housing, and that's the I think the success that's happening. Kamloops is a really small community. There's only 100,000 people there, and Kamloops Elizabeth Fry had over 116 units. It kills me that an organization as small as Elizabeth Fry had that many units. And the other organization that I worked for, they had over 290 units. And that's only 2 organizations in town. So I coming back to Saskatoon because I thought it was the right thing to do. And I was really excited about coming to work for Elizabeth Fry here and bringing some of the experience and knowledge that I got as a housing manager and a supportive housing coordinator to the organization here. And I knew that we didn't have any housing at Elizabeth Fry in Saskatoon. And it was my goal to start providing housing for people, because the first thing that I knew, and I knew this from being incarcerated as well, is the overrepresentation of Indigenous women in the carceral system is insane. I don't even know what other word there is for it. It's obviously a result of colonialism, racism, trauma, intergenerational trauma that's not being addressed. We don't have the proper supports and programs to the degree that we need. I think that there's a lot of community organizations in town that are doing their very best to develop programming and those sorts of supports and housing and that sort of thing. But the first thing that I noticed about Saskatoon is that we're all sort of working in these silos, and the provincial government has us fighting over this small amount of funds. And so in the meantime, while we're all, fighting over funds and trying to protect our own organizations and trying to come up with new programs to support people in this very obvious housing crisis and very obvious drug crisis, people are falling through the cracks. And that's what I see, because it's not about Elizabeth Fry, and it's not about other organizations. It's not about any one particular organization. It's about the people that we serve, and it's about community, and it's about making sure that we are looking at complex needs, because that's what we're dealing with. And those are the people that are suffering, and those are the people that are overdosing. So basically, what I've seen since I got here that's been very scary for me is the housing crisis and the amount of people that we have on the streets here. Winter's coming, it's cold. I think that it's absolutely crisis mode, and it affects the use of drugs as well. Pine Grove Institution right now, it has a capacity of 166. About a month ago, there was 275 women in that institution. They were double bunking SAG, they were double bunking secured, and 90 to 95% of those women are Indigenous women. So what I'm hoping for community is, and I've been doing my very best and reaching out to as many people as I can, is that we can start looking to a more linear model, a housing continuum, where we're going from, taking people from the street and providing those supports regardless of where they're at, meeting them where they're at. If it's harm reduction that they need, then we'll provide harm reduction. If they're ready for supportive housing, then we'll provide supportive housing. If they're ready for addictions programming, then we provide addictions programming. All of those things, and then, no judgment, reducing stigma. Because honestly, this is the thing. It isn't just the people that you see on the streets that have addiction issues. It can happen to anybody. And I think that people have these sort of preconceived ideas and judgment about who it is that's deserving. And we assign worth to people, and that's unfortunate because everybody is worthy. Everybody is worthy of support, and everybody is worthy of making sure that they have what they need. Housing is a human right. Housing is harm reduction. And I think that when people have stable housing, that they're able to start dealing with some of those issues. I think that that's about it, unless we have some questions.
Hi, I don't know how to say this bluntly.
No,
or-
say it,
Yeah,
please,
okay,
please say it.
I
Say
have
it.
to say it.
Yep,
For my daughter that's sitting right here that was incarcerated at Pine Grove.
right.
I think the services that Elizabeth Fry is growing
Yep.
and it's changing and it's for the
Yep.
better.
Yep,
So I commend you.
yep.
But in the past, I have to say, our experience was horrible.
Yes,
No calls back.
right,
My daughter was reaching out while she was in Pine Grove,
right.
and there was no answers.
Okay, I
So
can,
when she was coming out of jail,
yep,
I went on in a desperate reach out to CTV to get help.
yep,
Because at that point in 2018-19, there was really not much information or agencies connecting properly like what we're going to do today, what's happening today.
right.
So, I mean, back then it was added to our stress. So I went out there and I said, okay, I gotta do something for my daughter when she comes out. When she comes home, I have to be there in court for her, every court, so she knows I'm there. I have to support her, I have to show empathy, and put the anger away, but also I think more has to be done while they're there, when they're reaching out. So if I can be, know from yourself and the
Yep.
experience that we went through, please help the ones that are there right now.
I can absolutely
So,
address that.
thank
And thank you for your comment. And I openly love when people provide feedback to us as an organization.
Yeah.
Like I said, I've only been here since February, and I know that in the past few years, I think as a result of some changes in leadership, but also because of COVID and those sorts of things, that Elizabeth Fry, we were doing our very best, but I know that some things that absolutely were falling through the cracks. Since I came in February, I've had several goals. One of them is consistency.
Yeah.
And to make
Thank you.
sure that those phone calls are answered, and to make sure that when our staff say that they're going to be somewhere, they're going to be somewhere. And I think that we are gaining credibility in community again.
Yes, you are.
Yeah,
Absolutely,
and
I'm here to say and commend you for that. And I know that it's going to grow and it's going to be something really beautiful, because right now the women in are there and they don't have a voice. My daughter was
Correct.
in segregation, which was ridiculous, over 30 days. Where she struggled and she suffered enforced withdrawal.
yep,
Without any help.
yep. And I've been in Pine Grove. I was I was arrested several times when I was in active addiction, and I've been in Pine Grove, and it's not a nice place.
No.
Segregation, terrible. And I hate to say this about it was my experience, and it sounds like it was your daughter's experience as well. There wasn't a lot of supports in there. One of my really good friends died from coming off of drugs in that institution. I lost a baby, 8 months pregnant, in that institution. So I understand exactly some of the struggles that women are facing in there, and I think that that's part of the reason why I took this job. It was because I think that the lived experience that I have, and several of my staff, I have several experiential staff that have lived experience with incarceration, lived experience with recovery, and I think that that's also really important when we're talking about community and the services that are being offered in community. I saw the other day that they're having an overdose response team. Sask Health is doing that. And I was like, that's really great. But do you have a peer worker on that team? Because if somebody comes awake after overdosing and there's just a bunch of professionals there that you're probably going to feel like are judging you, that have no idea what it's like to have an opiate addiction, or no idea what it's like to be that desperate that you're using drugs, you want to have somebody there that understands what that's about. And it's really important. And I think that that's something else that we need to develop in Saskatchewan. I'm not trying to be critical of the province because this is my province. I grew up here. I grew up out in Dundurn. I love this province. And so, you know, it's that healing piece, but it's also, you know, making sure that people are being supported in the right ways. And I feel like we're kind of in the dark ages a little bit. And, you know, so I've been really vocal since I got back, and I'll continue to be vocal. And I'm encouraging our organization and other organizations to be a little bit critical of policy, be a little bit critical of our politicians, even on camera. Like, who cares? That's the only way that things get changed. And so I think it's really important that we as a group, we as a community, you know, come together to make sure this isn't okay anymore. You know, it's not okay that people are living on the street. It's not okay that people are overdosing. It's not okay that we don't have treatment beds. You know, it's not okay that we don't have sober living after people come out of treatment. Because 30 days, like Barb said, that's not good enough. Your family thinks, oh, they went to treatment, it's great, they're gonna be all good now. No, that's not it. Coming out of treatment, that's when the hard work starts. So we need to look at those things.
Awesome, thank you so much.
Yeah, no problem.
I think it's also important for our community members, not unlike Patricia, to hold our organizations accountable.
Yes.
I think she did a wonderful job
Yeah,
of that just now.
thank you for that, thank you.
Is there anybody else? No? Thank you so much, Nicole,
no
for
worries.
your time, sharing your expertise with us. We look forward to moving into the future with the Elizabeth Fry Society. Okay, and for our last speaker of the day, we have Tanner Parrett, Executive Director of Possibilities Recovery Center here in Saskatoon, Saskatchewan.
Hi, everybody. My name is Tanner Parrett. I'm a co-founder and executive director for Possibilities Recovery Center. Possibilities Recovery Center, I just want to talk a little bit about it. We are a registered charity. Our mission is to provide opportunities for recovery from addiction, substance use, for both the person affected by the substance use and their family. And so it's really important for us that it's a very holistic treatment experience. We kind of heard this morning that, you know, that 28, 30-day model doesn't work. And that's kind of how Possibilities came about. Within my own recovery from addiction, I saw, you know, there was a need for a different way to treat addiction. And as someone who just learns hands-on, my career has been spent in the trades. I worked through apprenticeship for my schooling because I look at a university almost like an inpatient treatment program that I just couldn't go sit in the university and learn. I needed to learn a little bit, get to work and put it to use. And that's basically what outpatient treatment does, is you come to us 3 hours a day, learn a little bit, some tools, get back out there in your daily life, your triggers, your challenges, and learn how to put it to use. If you slip, trip, and fall, you come back and say, hey, that didn't work. You know, let's try something else. And so that model has really been working well for us. Along the way with our programs, we've made some really great collaborative partnerships. And I would say, you know, Dan's definitely been one of them. Some of the programs that we offer, so we have an intensive outpatient program for adults, that's 18 plus. We have a youth intensive outpatient mental wellness program. For youth, we kind of go from 14 to say 22. You know, there's some, depending on maturity level, you know, we've had some 17-year-olds in our adult program, and we've had some 21-year-olds in our youth program. So we kind of make it as needed. We have our women's intensive outpatient program, which I'll talk a little bit about. It's a collaboration with Elizabeth Fry. And then we have Martensville Youth Connection, which I'll talk a bit about. It's collaboration with Carter's Counseling Services. And so before I get too far, I guess, seeing as this is Overdose Awareness Day, I really felt inclined to acknowledge our first responders. And, you know, we're all here as service providers. I don't know if we have any first responders here, but I think that the work and, you know, the PTSD even that our first responders deal with in saving and keeping our relatives, our friends, our colleagues alive, so that we can help them, I just want to make sure that we acknowledge them. So if there is, let's just give them a round of applause for all of our first responders. Thank you. So my first community partnership that I want to talk about is with Carter's Counseling Services. And so Dan connected Carter's and myself. We were both kind of working in the youth industry, and Dan said, hey, I want to put you guys together. You need to talk to each other. And so I sat down with Catherine Carter, and we both kind of said, hey, you know, there's a need for a youth outreach program. There's a lot of, Catherine has, what's the word I'm looking for? Experience working in the schools with youth as a mental health counselor. And so she saw that there was very much a need for education. And what we saw in the treatment world was, and it's not a shock to anybody, that addiction does root back to youth. And so I thought, you know, a good model as a charity is to work yourself out of a job. So we had to get from intervention of treatment into prevention. And so I thought, well, we got to get in with the youth and we got to start educating, planting seeds. And so I'm thankful for Dan that he connected us with Carter's, and Martensville Youth Connection has come out from it. And so it's an outreach program where kids can drop in. We're in the elementary schools in Martensville, and we kind of balance fun and mental health education where we're teaching the kids, you know, about anxiety, depression, consent, those kinds of things. And at the same time, you know, they're having a little bit of fun. It's voluntary. We don't want it to be too dry. Otherwise, no one will show up. And so that's been kind of a work in progress. We've been trying, you know, to expand it and get it into some other schools, which has been a little bit challenging. But, you know, that partnership in itself has been so fruitful. And without, I don't think without possibilities or without Carter's, it probably wouldn't have come about. And so that partnership's been really fruitful. The second one that I'd like to talk about is our Women's Intensive Outpatient Program. And so the last comment that came on the screen when Dan was moderating was from Kaylee LaFontaine. She was the executive director for EFRI. And we initially started working on this proposal with her. I'm not even sure how we got connected, but we had this idea that, you know, the people coming out of the justice system needed, you know, a greater amount of support to keep them from just cycling back in and out. And I said, well, you know, our program model that we have for addiction treatment might be a good fit as a piece of that pie. And so we started to put the funding proposal together with Kaylee. We submitted it into Health Canada. We were awarded this proposal for funding. Kaylee moved out, Nicole moved in. And so we have been working together with Elizabeth Fry to provide this program where the women that come out of Pine Grove are connected with housing and employment and community and cultural connections through Elizabeth Fry. And they come to us. We've altered our program to be a women-specific, Indigenous, culturally sensitive, evidence-based, that's a big mouthful, program. And it's been working very well. We've had really good feedback on it. It's been, I would say this is probably the most active partnership that we have is working with Elizabeth Fry, and they've been phenomenal to work with. We've had, it's been very challenging to have two organizations work together to develop something brand new that has never existed before, to work through the kinks and the road bumps that come along with it. And there couldn't be a better crew, I don't think. And I'm not just saying that because I know you guys are sitting there. It's been really good. Some of the other community partnerships that come within this women's program is we've had our good friends from Straight Up back there in the back. They've come in and presented to our group and talked to them, share their wisdom, share their knowledge. The First Nations University, we've had one of the professors from there come and speak. Oaks Mental Health is going to be putting on a presentation for those women. We are connected with Oxford House, that they help with housing. You guys have been awesome. So, I mean, really, we have some phenomenal community-based organizations here in Saskatoon. And if we can figure out through the policies and red tape as to how we can work together, I think that we can make a really big impact. I think it's going to be so important that we figure out how to do this. And, you know, there is a lot of rules and a lot of things that if they didn't exist, we could probably do this easier. But where there's a will, there's a way. Another partnership that we've had, and this is with an organization that's not from Saskatoon, but I can see them moving into Saskatoon, is the Men of the North. And so they run, it's a youth mentorship yard work program where men volunteer and young men volunteer, and the older men are mentors. The younger men, we do yard work for elders, single parent families, and persons with disabilities. And so we've been running this through July. We just had our wind up August 15th, I think it was. And that's been a phenomenal program to help, young men, to give them a purpose, to give them, some of them don't have a good male role model in their life. And I mean, we're not all perfect role models, but I think we did a pretty good job. And so that partnership with Men of the North has been awesome. We're looking at how we can continue to work with them to provide a treatment program up in L'Orange through Saskatoon here in an outpatient style. It's been really good to work together in that capacity. Really, I mean, the other thing that I guess I wanted to talk about being Overdose Awareness Day was medically assisted treatment. And so medically assisted treatment is something that is available now. We recognize it as a viable treatment option at Possibilities, and it does require a collaboration as well, because we need to be able to, as the treatment providers, help the individual speak and advocate for themselves in speaking with their doctors and speaking with their other wraparound care team, because a lot of people really don't know how to communicate or struggle with it. And that was something myself that I really struggled with. I had undiagnosed ADHD till in my 30s, and I would try, and I had so much going on in my head, I would just get frustrated and really couldn't communicate. And so I mean, even being up here, I'm pushing myself. I'm really nervous that all of a sudden I'm just going to lock up. I have sometimes the best way I can describe it is, have you ever seen those dirt bikes that go around and around and around in a globe? If you think of about 6 of them going around with that monkey that has the cymbals clashing in the middle, that's what I got going on up in here most of the time. And so I try and pick out a good thought and get it to come out my mouth. But yeah, the medically assisted treatment, that is something that's definitely an option for anyone using opiates. Opiates is one of the hardest things to come off of, and it's also one of the most susceptible to overdoses. And so at our table, we have this medically assisted treatment handbook. It's available at overdoseday.com. I just printed it off there yesterday. So if anybody wants to take a look at it, and if you have any questions about the program and how it works and how we do things, you can definitely ask me about that. That was kind of all that I have, Dan. I'm not sure, does anyone have any questions for me?
Questions, comments? I think you're going to get off easy today, Tanner.
Yes.
You
guys are the best.
You must have answered every possible question that could have possibly come into anyone's mind.
What I tried to do.
Just trying to get through the day.
Yeah.
Awesome.
All right. Yeah. Thanks for listening to me. And if anyone has any ideas within your organizations of how we could work together, come talk to us, because I think it's a great idea.
All right, that's it for us today. Just another shout out to the College of Nursing at the University of Saskatchewan for sponsoring us in our efforts to make sure we could bring this content to you. If you listened all the way to the end and you got something out of this, mark the date for next year. International Overdose Awareness Day will come again in 2024. We are planning a much bigger event. If you are in an organization that would like to take part in next year's activities, please reach out to me, Daniel at hardknockstalks.com. Other than that, take care for now, everyone. We'll see you again soon.